Doctors of Reddit, what home remedy has a patient try that backfired in the worst way possible? Tooth whitening with bleach baking soda mix. Repeatedly. Teeth were white and chalky, and you could crumble them with fingers. This is really horrifying for some reason. Like a nightmare. I remember a guy who came to the ER for a painful ear infection and his ear was a real mess. When I asked him what exactly he had done to treat it, he told me that first he stuck some minced garlic. Then he poured alcohol into it and then he shoved a cigarette, which, obviously, didn't get very far but still managed to burn him quite a bit. Wait, he shoved the lit end of a cig in his ear? One guy thought if he applied some dirt on the wound it would suffocate the bacteria and wouldn't get infected. I'm a physical therapist. A lot of my patients joke about needing WD-40 for their creaky and arthritic joints. Had another patient make this joke a few years ago. I politely laughed. He then leaned in real close and said, but sometimes I really spray some WD-40 on my knee and rub it in and it helps. Placebo is a wonderful thing. This reminds me of a home remedy I discovered inadvertently. My knee had been bothering me for many weeks. I hurt it skiing too hard one day and the pain just persisted for a long time. Nothing super acute. More of a dull but lasting pain. Well, it so happens I have an area on that knee from an ACL surgery years back that is still numb. So when I tried to quit smoking with the patch, I would apply it there. The patch tends to get itchy, so this was nice. So in another effort to quit smoking I applied the patch. And by the next day, knee pain was gone. For good. I looked it up and apparently nicotine has anti-inflammatory properties. We had a patient in our RUC who was having lower back pain, so he put ice on it. He said it felt so good and he hadn't slept in a few days due to the pain and he fell asleep with the ice pack on his bare skin. He woke up with the ice pack stuck to his skin and came into the office. He had second-degree burns and the blistered skin was peeled cut off with the ice pack. That's why my mother would always tell me to wrap ice pack in a towel. Ed nurse here. I once had a patient come in a kinetic crisis. They couldn't move except to talk, and even that was difficult. They were sweaty and really warm as well. What happened was that they had Parkinson's disease, had it for a while by then, but they'd been convinced by a friend to stop taking their meds and visit a Christian faith healer. They were convinced that their Parkinson's had been cured and that their symptoms were caused by their body getting rid of the Parkinson's toxins. One very long conversation with neurology later. We got them started on a couple of medication patches and admitted to the ward. But that was a super depressing presentation. A doctor here. So many stories. Had a young guy who got a penis fracture from his girl riding cowgirl style and he decided to just put an ace wrap on it. He was so worried what he'd see he left the ace wrap on for a few weeks before he came to the hospital because it started leaking pus. When I took it off I could hardly make out the anatomy, it was so distorted, but he had an open hole into the corpus cavernosa. Urology took him to the OR. I had a patient in clinic with a large breast mass. We asked how long ago she noticed it. She'd known it was there for about a year but was using anointed olive oil and prayers as treatment. The cancer was advanced by the time she came in. No. I have breast cancer. Stage 4. It sucks. The treatment sucks. But somehow, that is worse. I think it's the thought of all the unknown carnage that any metastases could be causing. At least I know where my meds are and what they are doing. Bones. And nothing for now. Former EMT and not a doctor. But one time had a patient who decided to cool her fever by dousing herself in rubbing alcohol. She then decided she needed a cigarette. We got to take her to the hospital for burns after her clothes caught on fire. Dousing. I think dosing yourself with rubbing alcohol would kill you without any fire. My sister is an OR nurse and apparently putting garlic in your vagina doesn't get rid of bladder infections. But apparently a lot of women try it. She's had 7 in the last 4 years. No number. You're supposed to do that when menstruating to keep pesky vampires away. PT stepped on a nail, and instead of just pulling it out, he decided that he should just put his foot in milk. 4 reasons. Pro tip, don't do that unless you want a serious infection. Bonus, different PT with another puncture wound in their foot decided to put their foot in Listerine. At least he didn't have to worry much about an infection from doing so. But that had to hurt. I'm not a doctor, but my overweight uncle started smoking to lower his heart rate. He had a heart attack. I used to work with a girl who was a 2-pack a day smoker and drank too much caffeine. Her logic was it's better for you than being obese. Not a doctor. But there was a story here in Argentina about a guy that had a horrible back pain. His solution? Injecting his arm with his own semen. He went like that for about 1 or 2 years. Then doctors had to cut some parts of his arm because it was wasted. How does that even make sense? What caused him to think that would cure him? Kinda the opposite. I had jock itch that wouldn't go away. And anything I tried would subside it and it would come back later. I talked to my PC and he told me to use a little bleach in water and spray it on myself. I didn't do that and instead saw a specialist, who told me it wasn't jock itch but psoriasis, and would have gotten 10x worse if sprayed with bleach. Well, jock itch being caused by a fungus, then the treatment would have worked if the diagnosis had been correct. But this is why if it's my skin I always see my dermatologist. I was listening to how stuff works and this guy decided to ingest colloidal silver for over 10 years to cure a skin problem and it ended up turning all of his skin blue. And it's irreversible. Colloidal silver is antimicrobial and being pimped by celebs such as Gwyneth Paltrow and Dr. Oz. But too much is bad. Unless you want to audition for the Blue Man Group. Edited to include article of this man. https://www. Nadala News. Com News National Man Turned Blue Silver Dies Article 1. 1,466,905. Have you heard of the Love Has Won cult? Their leader died of colloidal silver poisoning amongst other things. In the last pictures of her before she died, she looked awful and bluish silver. Edit. Fat fingers. Not a doctor but I worked in the air. A wife rubbed activated charcoal on her husband's infected legs, stating that she wanted him to have something natural and not toxic like those antibiotics. He later died from sepsis. Lady, bacteria are natural, but they're killing your husband. Not a doctor. Was in a small town of the ones where there's just a bunch of sheet thingies hanging from the ceiling to separate the beds, and the guy in the next bed had tried to remove a tattoo by heating up a spatula and burning it off. I guess it works but then he have a big scar instead. Not a doctor, but there was a story in China last year where in an attempt to cure his persistent constipation, a man shoved 2 live eels up his bum but he ended up getting his colon ripped apart instead by the fish. The man was saved by medical intervention but he nearly died from the experience. Even more crazily over the last handful of years. This is at least the 3rd time that someone in China has done this exact thing for the same reasons and to the same terrible effect. Ah. Yes. The classical I was trying to cure my constipation explanation. Dentist here. Patient had a ceramic crown fall off their tooth. Instead of coming in to see me to resmont it, which is very easy to do, they used superglue themselves. Don't do that. Please. The body does not like superglue. Original formulation of superglue was made for bodies, but was only used because using it was less bad than not using it. We had an elderly patient trying the Epley maneuver at home to relieve her BPPV, vertigo caused by crystals in the inner ear. The maneuver includes sitting on a bed and throwing yourself back onto your pillow. Harmless. Unless you hit the wall behind you. She suffered a subdural hematoma and had to get her skull drilled and sawed open to relieve the pressure. She died during post-operative care. That makes me extra sad. I've had severe vertigo and was at a point I'd try anything to make it stop. Could have been me easily. Patient came into the ED for basically necrotic toes. She said she tried soaking it in bleach a few times a day and it just kept getting worse. My mum has a story from 1990s China. She was a resident in an emergency room. A man came in with a jar attached to his stomach. Apparently he had tried to do cupping on his stomach, and the suction had just sucked a bunch of intestines in instead. Cupping should only be done on muscle groups by professionals, never anywhere abdominal. Not a doctor but I have read many stories about people using black salve or bloodroot to cure skin cancer. It's corrosive, not sure if it's the right word but it destroys the skin, so people end up with huge wounds, disfiguration, necrosis and sometimes have to amputate parts. Please be careful with what you put on your skin. Tap's head can't have skin cancer if you don't have skin. I worked in a private hospital, which specialized in orthopedic and ophthalmic procedures. As a runner and admin guy for operating theaters, we had a guy who had a knee replacement and let his dog lick the wound, because he believed that dogs have sterile mouths and that their saliva can kill bacteria. His wound was infected right to the bone and he had to have it redone at his expense. Not easy to redo a joint replacement and at the time it was around £12 14k. Private hospital. Had a guy who was experiencing erectile dysfunction. Decided to use the injections. Silas and Viagra all at the same time. He was having a pretty hard time when he arrived at the ER. My patient didn't like to use regular denture adhesives. Instead, she used fucking super glue. She got poisoned and died. Holy crap. I dislike loose dentures, but that's just bonkers. I'm not a doctor. I did however have a child with leukemia. My crackpot sister-in-law had recently jumped on the Juice Plus bandwagon. She insisted I give it to my kid because it cures me's. 1. Not the same thing. 2. No it doesn't. I tried to be polite and asked if it had vitamin C and grapefruit juice in it. 2 things she currently couldn't have because of her chemo. She said it did. I told her that she couldn't have it. She kept pushing me to just ask her oncologist. I told her I didn't need to and gave her the reason. Her solution? Obviously we needed to stop chemo. Needless to say she wasn't allowed alone with my kid after that. My husband had a guy who came in with vague neurological symptoms. Turns out he was ingesting borax to increase his boron levels. Eater. Husband said the guy thought it would help his arthritis. What a boron. This was in news. That a 24-year-old guy who didn't have condom used superglue to cover his penis to have protected sex. He later died. What killed him I need to know. We had a lady who got poison ivy on her calf and shin. Simple enough to treat, right? Well, she decided to dry it out by dipping and soaking her leg in bleach. We amputated. Not a doctor, but work for one. A patient believed she had intestinal parasites and read that drinking paint thinner would help. This made the lining of her intestines start to slough off and come out in her excrement. She saw the white stuff in her poop and thought it was proof that she had parasites and this treatment was working. I really cannot overstate how normal this woman seemed before all this. If a coworker had told me this story and asked me to guess which patient this was, never in a million years would I have guessed it was her. Everyone was shocked, including the therapist on staff who saw her twice monthly. The doctor had to send her a message over the portal begging her to stop because she was killing herself. Unfortunately, that's a real, dangerous line of quackery in some underdeveloped countries and among some of the crunchy mommy set. Make the sick person autistic kid drink bleach. They crap out white worms. That means the bleach is totally working and therefore do it again. Cue dead sick person, or kid in hospital with ruined intestinal lining. Very angry doctors. And an open child services file because you wanted to cure neurodiversity. I'm not a doctor, just a medic. At the start of the pandemic I was working in the ER. Patient comes in with arrhythmia and other issues along with being COVID positive. His home remedy was to huff Chinese herbs because it was a Chinese virus. We all were in disbelief back then that someone would try that. Outstanding move. They likely heard from their grandfather that eating paella was effective for the Spanish flu. Had a patient doing urine therapy, which involved putting her own urine in her eyes. Came into the ER with severe conjunctivitis. I don't often have to consult ophthalmology, but I was genuinely concerned she'd permanently lose her vision. Your body gets rid of urine for a reason, people. Leave it out of your body where it belongs. A girl in my class had a earache and decided to pour hot olive oil down her ear. Went to the hospital and was off for like 2 months. Edit. Just to clarify. She said it was boiling hot and she poured quite a bit down, whereas docs recommend 2-3 warm drops. Not a doctor, but some middle-aged guy in my neighborhood, father of 2, tried removing his tooth with some mechanical equipment. Many warned him and suggested him to visit a dentist, but he just ignored them. His tooth did came out with the equipment, but he did something really bad to his skull which eventually killed him. I was 11 or 12 at that time and only knew that guy because he used to sell LED lights and other school project things. Relatively minor thing I did once but got a lecture from the doc about. I was camping and a bug flew in my ear and died. I thought I got it out with the arm of my sunglasses. I honestly completely forgot about it until like a week later when my ear was totally infected and swollen. The doc was like, next time just come see us. Found a cavity in a little girl's tooth and rather than have it filled, mum tried to heal her kid's cavity with oil pulling. Kid came back for her 6-month checkup and mum expected me to see the cavity was healed because it had stopped hurting. She told the hygienist not to tell me because she wanted me to be surprised when I saw it. The cavity had grown so large the tooth needed to be pulled. Massive giant hole in it with tons of decay. You don't have to be a dentist to understand you were looking at a massive cavity. It had stopped hurting because the nerve had eventually died and was causing an asymptomatic infection. Poor kid. Oh. Had a patient once who refused to treat a tooth, saying that charges for the treatment were too high and it was more cost effective to use a piece of clove or clove oil to mitigate the pain. Came back a few months later with a big swelling. I mean, I've opted for a cheaper extraction against the wishes of my dentist as opposed to a more expensive root canal before. But I was working for $7.45 per hour at Walmart at the time. I can kinda see where the guy is coming from. But the clove thing was stupid. Used to work with rural Tennesseans. Apparently putting bacon on open wounds is the thing to do there. It helps pull the pound out. It doesn't work. Pound, for those curious, is likely misaligned keyboard for pain. Not my story, but a teacher from high school. She was teaching an elective health class. She used to be a nurse. Told us how a woman had her daughter sit in a kiddie pool filled with bleach because she had an STD. Poor girl had some serious chemical burns. Dear God, did they call CPS? Not me, my wife. When she was in medical school doing rotations, a woman presented to the OR with abdominal pain. She wanted very badly to get pregnant. So, she shoved an entire raw chicken up there. Like the whole damn thing. Home remedy didn't work. Believe it or not. Now I'm just curious what the hell the end game was meant to be. I mean, how is that even remotely meant to work? Right after COVID hit America, a teen came into the OR where my best friend works. The girl was extremely ill with a busted head. The mum refused to believe her daughter had COVID and was treating the child's symptoms with pickle juice. When she got so weak she couldn't get out of bed, dear old mum yeeted the pickle jar at her head. Cops and CPS were called. Good. I'm glad cops and CPS were called. That poor little girl. The fact that her mother let politics get in the way of taking proper care of her daughter is downright shameful. Then on top of that, she hucked a friggin' glass jar at her daughter? WTF. Not sure if counts, but there was this cancer stomach patient who ate 2 kilograms of pomegranate at home. They were surgically removed that very night by the not so happy surgeon. I was the intern. I'm pretty sure the moral of the story is usually, they later died of sepsis. A guy came in with a bad eye infection. When asked about it, apparently it was itchy a couple of days before. So he put a mother's breast milk on it so the antibodies there would fight the infection. There was also another guy who was complaining that mefenamic acid did nothing to alleviate the pain of a wound on his knee. This was because he kept opening the capsule and spreading the powder on the wound. The stories on this post make me realize why this pandemic won't ever end. People are so medically illiterate that it's making my head hurt. 6-pack of beer for a heart attack. I guess it didn't backfire, but it didn't cure his chest pain. Not a doctor, but an underground mine engineer. I learned through college and from older friends' family in my hometown in northern Ontario that miners would inhale McIntyre dust or aluminum dust before and after every shift to protect their lungs from silicosis. This was a thing for years between 1920 to 1960 or so, especially common in uranium and hard rock mines. It was later proven that it had no benefit against silicosis and has been linked to increased risk of Parkinson's disease, not to mention years of lung disease illness. To make things worse, it was backed by the mining companies and Canadian government for many years. My buddy poured red wine on a cut he got from walking through a glass sliding door while drunk. He woke up with flesh-eating disease and had to have multiple skin grafts. It now looks like a shark attack scar, which is what he tells women at the bar. Former dental assistant. Patient came in expecting us to be proud that they will have no cavities because they started coconut oil pulling. Basically rubbing coconut oil over your teeth to pull out toxins. Well, they left the coconut oil on their teeth, leaving this bumpy filmy layer. Their breath also stank like something I never smelt before. Oh, and they still had cavities. Needed a root canal and a referral to the periodontist. Just stick with the basics. Fluoride toothpaste and floss. Especially at night before. Fluoride based mouthwash if you wanna be extra precautious. Or really cavity prone. Go get your twice yearly cleaning and exams and you should be fine. Sugar and soda are fine. Just make you do the above but also drink a lot of water as well. There's nothing worse than hurting children for their entire lives. I'm a medical student in a third world country where many people still hold traditional beliefs that are irrational. There have been cases when children get sick so parents think they have maldojo supposedly happens when someone looks at you with despise, so the parents take them to subadors or curanderos, which basically are people that give the child a massage, suck the fontanelle and rub an egg on the child's body to cure them. This manipulation has resulted in many cases with cerebral damage, leaving children with cerebral palsy or even dead. Local news report, https://www. La Prensa. En Honduras por liberalo de maldojo curandera causadano cerebral a BBSLP 970,313. We had a patient in the ICU who came in with swelling and necrosis to one of her breasts. She ended up leaving AMA but came back the next day because it was worse. In the interim she and her friend sprayed WD-40 on it assuming that would help. It was an infection from injecting meth. She lost the breast. One of my patients crushed oral antibiotics he had at home and rubbed them into an infection on his leg. It did not work. Didn't want to take aspirin so took them intravaginally. Needless to say it was not pretty. PO is the Latin abbreviation for by mouth for anyone confused. Guy tried to make his dick bigger by injecting stuff into it. Hey kids, don't do this. Not exactly a home remedy, but I had a patient come in because she was having issues with urinary incontinence and frequent urination. I eventually asked her how much she was drinking each day, to which she stated she drank half her body weight in water every day because she heard somewhere that is what you were supposed to drink to be healthy. She was drinking 120 plus FLOs, 5L, a day. Needless to say, you don't need to be drinking that much water. Just drink when you are thirsty and your body will do what it's supposed to do. I was the patient. I felt hard on my back and my nurse and doctor friends told me to just keep applying heat even though it kept hurting and stiffening. Went to the doctor and after an x-ray they told me it was ligament swelling and heat made it worse. Oops. Don't listen to your medical friends unless their advice is go to the doctor. I've seen several posts in our Herman Cainwood about people taking ivermectin for COVID and then having to have portions of their intestines removed after pooping out necrotic pieces of their intestines for a few days. Made me realize how dangerous it was to be clinically stupid in the modern media landscape. Not a doctor but was briefly a dental nurse, and we had a fella who tried to extract his own rotting teeth with pliers. He was only partly successful and snapped off all the roots, which then got infected, so we had to go in and slice open the healed over gum and yank out all these shards of bone, even the uninfected ones, before we could even begin to get him fitted with dentures. My cousin fell and bumped her head when she was young and had a large bump. My mother put a penny over it. It didn't do anything and my cousin looked a twat. Bleach on rash. I once had a gentleman come to the ER after he tried to dislodge a piece of meat stuck in his esophagus with a stick he found in his backyard. Needless to say, he ended up shredding his entire food tube. Saw a patient with prostate cancer that by the book should have been curable with surgery. He ran off to see a herbalist who had him take D. His wife managed to bring him back about a year later and he wanted surgery. I rechecked his SAR first before agreeing and it had skyrocketed. Bone scan showed diffuse mets. So no point in surgery anymore. Not a doctor, and not really a home remedy, but when I was a kid I had tight foreskin. Couldn't pull back over the head of my penis. The doctor told me what I should do at home was when I had an erection I should try pulling the foreskin back over the tip, to try and stretch it out. This all went tits up when I finally forced the skin all the way back and had to go to R&D when the blood flow to the end of my penis got cut off by my own foreskin. The first question the doctor at R&D asked was, why the hell did you think this would work? Garlic clove to cure bacterial vaginosis. She called because she couldn't find the clove. She had taken a spoon to dig it out. Still couldn't find it. Had to come in and get a spec exam. We couldn't see it. The assumption is it fell out at some point. It didn't clear up her BV after all that. My wife is a veterinarian. It's not uncommon for her to treat animals for toxicities involving their owners giving them seemingly innocuous human medications. One of the stories I heard, and I can't remember if it was her patient or one of her colleagues, was about a human doctor accidentally killing his dog with an OTC NSAID like ibuprofen or naproxen. Not my story, but my mother's. Old guy, bedbound. His children decided to treat the pressure sores on his heels with raw potato compresses. You know. Old school style. I'm going to go out on a limb here and assume that all the starch in the potatoes contributed to getting this poor man's heels infected and eventually he had to get a double amputation. A nurse. Not a doctor. But I had a little girl a while ago who had gotten second-degree burns from somebody water spilling on her. Her family used mustard as burn cream basically all over her torso and arms. Her family didn't bring her to the ER until the next day, so she was covered with blisters, peeling skin, and dried mustard. We had to scrub the dried mustard off before we could even really see what was going on with her burns. Very sad case. Once had a patient ask if his clonidine would help in the event he was bitten by a rattlesnake. I don't know if he tried this, but I hope not. Nad, but my parents are and they saw a guy who got paint in his eyes and poured paint thinner in his eyes to wash out the paint. One from my sister, who is a forensic psychiatrist. Not sure if it's a home remedy as such, but she had a patient who set fire to herself and her 2 children because she thought it would cure them. She was schizophrenic and thought her family had been possessed. Needless to say, it did not. It did, however, kill her 2 children and result in her legs being amputated. The tragic thing is that the patient is now responding well to therapy. Had she sought treatment sooner, she probably could have managed her condition. It was one of the cases that resulted in my sister switching from forensic to geriatric medicine. Had a neighbor who was too cheap to go to the doctor when she hit her head on the sidewalk. She was bleeding profusely. She'd put vinegar on her wound and would pick at it. She'd then dry it, and when scabs formed she'd rip them off and pour more vinegar. She was found dead and I've heard she died from sepsis or her head injury got worse. There are also rumors she treated all her injuries with bleach or other cleaning solutions. Another one is an aunt. She tried to cure her diabetes by drinking a lot of alcohol and eating only bread. She looked like a bloated corpse. She lost her legs and tried to cure her diabetes again by eating only salty foods, which made her kidney stones worse. This is embarrassing. But I had, what I later learned was, an infected cut on the tip of my penis. Because of the location and context, I thought maybe it was an STD, genital wart or something, and applied like normal wart treatments to it. It hurt so bad and did not help at all. After way too long, even a ruined relationship, I finally went to the doctor, ruled out all STDs and took steroids and antibiotics for the infection. It cleared up in like 2 weeks after that. But I have really bad scarring. Moral of the story: don't be embarrassed about genital injuries and don't be an idiot. See a real fucking doctor. Not exactly a home remedy, but a patient that I took care of had sciatic pain that was unrelieved by oxycodone. The guy figured that crushing his oxycodone and injecting it into his thigh would be more effective. He basically ended up giving himself severe cellulitis and had to have a large incision and drainage surgery, and a couple weeks of antibiotics to clear the infection. Pediatrician here. You wouldn't believe how many parents and grandparents think it's a good idea to treat the burn wound of their child with toothpaste or flour. Or even worse, a mixture of both. Getting the stuff off while cleaning the wound is a nightmare. Don't ever put random stuff on open wounds if you don't exactly know what you're doing. My wife had a patient that came in with an eye infection. The patient claimed that she had been doing urine therapy with her own urine, but the infection still wouldn't go away. My wife suggested maybe she stop putting urine in her eye and see if that helps. Eating live slugs for stomach ulcers. This was somewhat a grandmother's recipe in his village. Poor man came to the ER with severe upper gastrointestinal bleeding and received proper medication. Used to work in urgent care, a woman burned her thumb while cooking, and to treat it she wrapped numerous rubber bands around her thumb and left them in place for a week under some gauze wrapping, effectively putting a tourniquet on her thumb. By the time she came into my urgent care, complaining of pain spreading to her hand, her thumb was practically black and falling off when we removed the bandage. Vet tech nursing student here. The amount of lemongrass, peppermint oils and garlic that people put on their pets or force their pets to ingest is way too damned high. These things are often toxic. They don't kill anything. I don't know how many times I've been like, see that? Flea infestation, or see that? Those are roundworms with people torturing their pets. Many people apply these oils and such topically, causing terrible allergic reactions and skin infections. Then fight you that reality isn't reality. I can't wait to start working in the human ed. This just happened a couple of weeks ago. A patient was retaining urine and was warned that if it persisted, he would need to go to the ER. His solution was to use a syringe that he had for giving his dog medication and spray his genitals with hydrogen peroxide. A doc here. My god, so many stories. Most relevant one would be, patient drank bleach to try and cure COVID because he heard some famous person suggest it. He is dead now. This was a while ago. It basically ate through his esophagus and the upper part of his stomach. Nothing that can really be done for it. Treatments weren't working. Painful death over days. Then I had this other guy use marijuana before having sex. Beck, apparently that is a form of birth control. He was very upset to learn his girlfriend was pregnant. With twins. Patient with colorectal cancer. Convinced by their family to decline medical advice and pursue natural remedies. Finally returned about 6 months later. The tumor had eroded through the abdominal wall, perineum and genitals. Not a good way to go. And very sad.